My name is Jo Boufford. I'm a clinical professor of global public health and pediatrics at New York University, and I was delighted to be here as moderator of this session on pandemics, especially looking past the COVID epidemic, our most recent memory trace, to sort of how do we do better the next time. We had two fantastic panelists, Ashwin Vasan, who's obviously the health commissioner of New York City, and our colleague Saira Madad, who leads the entire infection control process for the public hospital system. And they were really talking a lot about the reaction, how do you manage things on the ground. I think the takeaways, a couple of things I'd say from their discussion, one being that the action really happens locally. So though we have global policies and procedures and others, they can't get implemented unless there's a capacity at local level and the political will at local level. A second important issue was the degree to which we need to, I think Dr. Vasan mentioned, invest during peacetime, which is when we're not in a crisis, really be sure that we develop the partnerships we need, that we develop the communications mechanisms, the data systems, the partnerships that are really needed to respond quickly during emergency, and the fact that we can mobilize across sectors that may or may not work together in an emergency, but often it's over when the emergency is over, and sort of how do we create and sustain those important relationships. And then finally, I think they all commented on the degree to which, because of the political visibility, the media visibility of emergencies, especially infectious disease threats, how do you keep people informed and the public informed, but how do you have the staff continue to be able to do what they need to do every day to make sure the public services and the healthcare services are there? And I think both of them probably most importantly emphasize the need to invest in the workforce, the healthcare delivery workforce and the public health workforce. Obviously a lot of burnout, a lot of vacancies as a result of COVID and the sort of heroic work that people did do, but also making sure the budgets are there and making sure the support for staff and the training that's necessary is invested in by local governments and by global bodies and global donors. So I think that's kind of the big items. It was an interesting discussion. I thought they were terrific.